Welcome back to Western New York Living. I'm sure there are plenty of you watching right now that do a great job of living a healthy lifestyle. Maybe you work out, watch what you eat, and visit the doctor regularly. But did you know you could be doing more? I recently visited Windsong Radiology to find out more about the different types of cancer screenings available. As I found out, today's imaging technology is one of the most important tools available in the fight against cancer. The American Cancer Society estimates that more than half of all cancer deaths could be prevented if people adopted cancer prevention measures, including checkups and screenings. It has been 30-plus years since Windsong opened its doors with an original focus on breast cancer screenings. Today, Windsong Radiology ranks among the largest screening and diagnostic facilities in the nation, focused on a multitude of life-saving cancer screenings.
Over the last few years, we've become a nationally recognized center of excellence for screening for other cancers, including lung cancer, prostate cancer, and colon cancer. With improvements in technology, we've been able to better image other forms of cancer. So with lung cancer screening, we use the CAT scans that I think a lot of your viewers are familiar with, and now with improvements in technology, we're better able to image the lung and look for small nodules and small lung cancers. And in a similar vein, with improvements in technology and MRI, we've got faster, better scanners, and we can actually now image the prostate gland, which is a huge revolution in early prostate cancer detection. And I think we've now, in this the year 2019, with improvements in technology, we're able to actually image a lot of these disease processes and catch the cancer early. And I think it's important to stress to your viewers that these imaging tests are minimally invasive. So they're not subject to a surgery or to a biopsy or what have you. And a lot of these disease processes we can actually physically see on a picture, on an image.
The doctors and staff at Windsong all take pride in being the first designated lung cancer screening facility in the area. Patients who meet the criteria and who choose to be screened are more likely to be diagnosed at earlier stages than unscreened patients. The same can be said for 3T MRI prostate cancer screenings for patients that may have elevated PSA.
Most patients typically will get a PSA test, usually around the age of 50. If they're African American, they actually get it at a younger age, typically at the age of 40. But then based on those PSA tests, if those PSA levels are elevated, then they might be a candidate for a prostate MRI. So we're fortunate now with the advancements in MRI technology. Now if a patient has an elevated PSA, rather than going straight to biopsy, they can get an MRI done. And if the MRI shows nothing, there's actually a 95% chance that there is no cancer there, which is quite assuring to the patients. And if there is something suspicious in MRI, we can actually biopsy directly by MRIs. And I think that's critical. Hopefully your viewers understand that is that if we see nothing, great. Rest assured, there's a 95% chance you have nothing there. But if we do see something, we can actually biopsy the nodule using MRI guidance. And I think that's a huge revolution in prostate imaging and early cancer detection.
For those over the age of 50, a routine colonoscopy is a common screening. But for some, a virtual colonoscopy may be more appropriate and better suited for specific patients.
Patients who either can't tolerate the sedation and, like I said, can't undergo the regular colonoscopy because they're on blood thinners or the colon is very tortuous, and the gastroenterologist is unable to pass the scope through the colon. Those are patients who are prime candidates for the virtual colonoscopy CT. So I think it's important to educate patients that we've got simple, easy, minimally invasive tests that can potentially catch their cancer, if they have one, early and at a treatable stage. So I think there's a component of, at least from our standpoint, as a provider, we got to provide education to the patient and then also let it be known that we're there as their advocate. To find out more about cancer screenings and all the services they provide at Windsong, head over to their website at windsongwny.com. There you'll find information on all the screenings Dr. Chervu spoke about and the other helpful resources. Their main campus is located at 55 Spindrift Drive in Williamsville, and you can give them a call at 631-2500 to speak to their very helpful staff.